All right, so the purpose of this video is to share a bit about what I think everyone should know who is discerning if they want to attend naturopathic medical school or if they're exploring the field for the first time and looking to learn more about what a career in naturopathic medicine entails. Granted, I just finished my first year of schooling, but within that first year and all of the additional research and conversations that I've had involving the ultimate career paths within naturopathic medicine, I feel I have a pretty strong gauge on what the schooling especially, but also what life after naturopathic medicine looks like for most people, or after naturopathic medical school looks like for most people. So with that said, I want to start by saying that anyone of any background can thrive in the naturopathic medical doctor program. I had a complete business background, went to business school for my undergraduate degree and ended up doing a bunch of post-batch courses basically to have the credentials to apply and attend the naturopathic medical school I currently do. So I didn't really have a super crazy hardcore in-depth training in the biochemical sciences, but with that said, they do train you in all of them. So the whole first year is really focused on learning all of the different bodily systems and different and learning your core science foundations like physiology, anatomy, biochemistry. With that said, there was little to no organic chemistry, a lot more biochemistry, which was nice because out of all the post-bachelor degree courses I took in the sciences, obviously organic chemistry was the worst. So that was nice. But yeah, I've ended up doing really well in the program. I've done well in all of my classes so far. So that's not to toot my own horn, that's just to say that anyone who is passionate about the field of medicine and specifically naturopathic medicine can do well in the program. And also, that's not to say the program isn't intense. It is incredibly intense. I was doing some research and talking with my brother who's in a DO program not far from me right now. We started about the same time, so we can talk about the courses, and our first year curriculum was more or less identical. And so you're getting that strong foundation in the sciences, but you also have to commit the majority of your time to school. It's pretty difficult to have ton of free time outside of studying and everything, depending on if you want to do really well in the program or if you want to, just barely pass your classes. But I feel if you're going to become a doctor, you should have the passion to want to master the material. And so to do that, you will be committing basically most of your time and energy into your schooling. So in comparing the MD and DO curriculum with ours in more depth, we have basically the same amount of contact hours in the clinical years, which are the third and fourth years of the program, and we have more credit hours, substantially more credit hours than MD and DO school. So a bit of that is how they record the credits, but a lot of that is just by the pure fact that we get a ton of additional education in things like nutrition, mind-body medicine, environmental medicine, botanical medicine, Chinese medicine. So we just learn some additional tools for us to use as future practitioners. And that is not at the expense of getting that depth in pathology of different diseases, because we still have extensive education in disease processes and how different systems become dysfunctional, which result in these various disease states and pathologies. So the difference largely is how those conventional schools will spend a lot more time getting more in depth, specifically with how to prescribe pharmacological agents and therapeutics, pharmacokinetics, and more granular with that, so they can end up prescribing a broader scope of medications. Obviously, in our schooling, the goal is not to have patients who rely on medications to live. They obviously have a time and a place, which is why we learn them, and most naturopathic doctors still do leverage them in the right context. But again, a lot of the times we're trying to reverse disease states and get people off of the medications that typically are basically masking symptoms or helping them not get worse, rather than actually curing or reversing a disease state someone might have. So yeah, there's that. Also, just to put in perspective how difficult the schooling is, through speaking with a bunch of upperclassmen, if you start on the 4-year track, which a unique aspect of our med school versus conventional medical schools is we have a 4-year and a 5-year option. But for those who start on the 4-year track, I've talked to numerous people who have said anywhere between 20 to only 30% of the people you would start with, you end up graduating with on time in that 4-year period. So a lot of people end up moving to the 5-year track, or just failing a class or a milestone exam or something that sets them back a little bit in the program. A lot of people choose the 5-year course right away, which is completely respectable too. Some people, they might just want to have a better school life balance or work outside of school, and that makes it a lot more manageable. But the 5-year track only splits the first year of courses. So the following 3 years of the program are all in one timeline, basically. So it's a difference there. And I think it's just important to emphasize that you're trained conventionally as well as naturopathically. So a lot of people who think that naturopathic medicine is just about herbalism and acupuncture, it's really not at all. We haven't done virtually any of that in the first year. It was all hardcore medical sciences and learning pathology and anatomy and physiology and biochemistry, all of that, and doing some physical exams like chest, lung, cardiovascular, and even some more invasive stuff. We did injections, phlebotomy, which will eventually culminate into minor surgeries. So if you're someone who is really passionate specifically towards one modality of naturopathic medicine, I would look into the schooling that's specific to that. So like, herbalism schooling or acupuncture school, just to go off those examples I gave. But it really is a comprehensive program. You're gonna learn a lot, and so it's a program for people who want to eventually become full-fledged doctors, who can evaluate health in both a conventional and holistic way. And if that's you and you have that passion, then program and a career in naturopathic medicine might be for you. But there are a couple other things that are important to consider. So if you want to get rich, this is also not the field. You're typically not going to make doctors conventional doctor salary, although there's major variability depending on if you decide to specialize in things like functional medicine or regenerative medicine, oncology, stuff like that, which you have the option to do so after the 4-year program is over. You can do continuing education to specialize in a certain modality, or you can do a residency, which might teach you more specifically about one field of medicine. Like I did my field observations at an oncology clinic, so they were all naturopathic doctors who had an integrative approach to oncology. They offer residency that is specific towards oncology training. So that is where you can make a little bit more money, or of course starting your own practice, but also my understanding is there's not much training at all, formal training or education, and how to do that in schooling. So that's where things like clubs or having a business background can come in handy. So I would also say that everything is kind of cumulative and builds. So you don't really want to pump and dump anything you learn, because you'll have to know it later on. So if you're someone with a really, bad memory or struggles to do that, might not be the best field, because it's just such a massive volume of information. And you'll need to be able to hold on to it and use it for future larger exams like boards, and then also obviously as a doctor. So those would probably be the main things that I think people should know before attending naturopathic medical school. It is medical school, it's very hard. It's only been getting harder too for me, and I just finished my first year. Apparently second year is supposed to be pretty rough too, so we'll see. I'm gonna try and keep making videos to document the journey and everything and share what it entails. So thank you for watching.